community and wholeness and health. This is what we're talking about right now. Cold and flu season, it's here. It's not on the way here. It is here. I've seen people around work, hacking and coughing and wheezing, and I'm like, get away from me. I don't want none of that. And which is why we welcome back to the show Joelene Huber. Thank you so much for joining us on the show.
Thank you for having me.
Now, of course, you are of today's parent as well. You are a pediatrician.
Right.
Now, a lot of people, when they hear that cold and flu season is among us now, we're like, Will, you're wrong, because we still got to get through Halloween, and then once we get through Halloween, then we hit November. That's when I started thinking about getting my flu shot, but that's not always the case.
Right, and that's actually on our quiz today. It's my first question for you.
Oh boy, I'm going to be quizzed.
Oh,
yeah, usually it's me asking the questions, but today I'm in the hot seat.
Right, yeah. I get to play host and ask the questions.
Okay.
But you're right. I think when many of us are thinking about what are we going to wear for Halloween and candies and pumpkins and all of those kind of great things, it's also a good reminder to think about the flu shot.
Exactly. Now, everyone I know, and I mean everyone I know, has an opinion about the flu shot. People are either picketing that it's a good thing to do, or they're against it. They don't believe that it's appropriate, doesn't work for them.
Right. Yeah. So we'll talk about some of the common myths or and good reasons to get it, and other things that you can do to help prevent the flu.
I'm ready. I'm in the hot seat.
So let's start.
I want you to put me to the test.
Okay, so we'll give you an easy one first.
Okay, let's do it.
It's almost Halloween. That means it's time to A, decide on your kid's costume or your costume. B, carve a pumpkin. C, get the flu shot. Or D, all of the above.
I'll say D, all the above.
Right. So that I started off with an easy one. So,
one for one.
And it takes a couple weeks for it to start working. A lot of people don't know that. And so that's why we say get it now. Think about Halloween, get the flu shot, and then by the time cold and flu season really kicks in, then you're protected.
But what about the idea that, once you get the flu shot, you're kind of given a little bit of that virus, and people don't have the immunity to kind of fight that? What do you say to people who argue that?
That if you have it, then you won't have.
Yeah.
Well, it's actually, so the flu shot has, most of them are called trivalent, meaning 3. So it has three viruses that they're trying to match or mimic three viruses that we think are probably the most common that will happen this season. And so it sort of helps, they try to match it to what they think is out there and help prevent
to fight it
from
off.
getting it. Yeah. So we should go to the second question.
I'm ready.
Okay, what's the difference between cold and flu? A cold is only a cough and runny nose. B, flu symptoms are often more severe and may progress to more serious illness. Or C, the flu is throwing up.
I think B.
Yeah, you're right.
I think B. I mean, I used to think it was C.
Yes.
Because when you hear about the flu, you think the stomach flu or like a stomach virus.
Yeah.
But, you can have some of those symptoms without being
right,
sick.
and there is such a thing as the stomach flu. When we talk about flu, we usually mean influenza. That's where we get the word flu, and influenza is a type of virus that causes the flu. And with kids, it's a little more tricky because the flu is sudden, high fevers and chills, but they can also have some diarrhea and throwing up. But it's those body aches and that really high fever that sort of distinguishes it from the cold, which is a little bit more mild. The cold may not progress to more serious illness the same way that flu. So a lot of people don't know that many Canadians actually die from complications of the flu each year. So pneumonia, or kids get the croup, or what's called bronchiolitis, which is an infection of the airways to the lungs. So there's lots of ways that kids can actually get more severe illness from the flu than just sort of the common cold.
So far I'm 2 for 2.
You're 2 for 2.
Okay, let's keep going.
So who is most likely to get the flu? A, young infants under 2 years. B, 2 to 4-year-olds.
Okay.
C, 5 to 9-year-olds. Or D, adults 65 years of age and older.
That's a really tough question because there's 2 different groups that I would want to say would get the flu.
Okay.
I want to say 5 to 6. It's kind of a tie for me between 5 to 6-year-olds.
So 5 to 9-year-olds.
5 to 9-year-olds and senior citizens.
And so you're right. It's the C, the 5 to 9-year-olds. It's kind of a trick question because the 5 to 9-year-olds are the most likely. The question was who's the most likely to get it. They're the most likely because they're all in school together. The 5 to 9-year-olds are probably not the best thorough hand washers.
They're hugging each other. They're sharing snacks. That sort of a thing.
But it's you were right in the adults that are 65 years of age and older, and infants under 2 years of age is probably what you were thinking are the ones that get the more severe illness. So they're the ones that are more at risk of severe illness.
Okay, cool. So I kind of got
hospitalized,
that right.
Yeah. It was
we'll say
trick.
that.
It was a trick.
Look at her tricking me right here.
So number 4, what is the best way to avoid getting the flu? A, stay indoors as much as possible.
Okay.
Like Mom would say, put your hat on.
Yep.
B, take vitamin C daily.
Okay.
C, practice yoga.
Uh-huh.
Or D, get the flu vaccine early and wash hands regularly.
I think it's going to be D.
Yeah,
get that flu vaccine and wash those hands.
Right, and it's so a lot of people used to think, going outdoors in the cold, you'll catch a cold, but really it's actually...
That's a myth, isn't it?
It is, and staying indoors is what probably is contributing. We're all indoors, we're all in close proximity, so we're sharing more germs in the winter. So staying indoors actually may be contributing.
Especially if you have a family of 5, mom and dad, brother, sister, your partner, whatever
all
it
there,
is.
And we all get sick at the same time. And taking vitamin C daily, there's some studies that it may help a little bit, like by 1 or 2 sickness days in your whole year.
Yeah.
It's more probably better for as an antioxidant, and practicing yoga is good for wellness. But really, it's the flu vaccine and hand washing that's our big way of preventing.
Awesome. Do we have any more questions?
We do. Okay. Number 5, at what age should children start getting the flu vaccine? A, 6 months.
Okay.
B, 1 year. C, 5 years. Or D, it's only given to adults.
I'm going to say C.
C for 5 years. A is 6 months. So
6 months?
Yeah, so at 6 months you can start getting, and as I said, it's really important in that group from 6 months to 5 years of age that we really think about getting our kids vaccinated, because those are the highest risk age. Yeah, for getting
And I think we have time for one more question.
One more question. Okay. This is a good one. What types of flu vaccines are available in Canada? A, flu shot, so the injection only, the intramuscular injection. B, nasal spray only. C, flu shot and nasal spray. Or D, nasal spray vaccine is not available yet in Canada.
Oh my goodness, you've stumped me on this one. I'm going to say D.
So it's C, flu shot and the nasal spray. So at 6 months, you can get a flu shot. If you're over 2, the kids can actually get a nasal spray vaccine. So they don't have to have a shot. It's not covered it's not free in all regions, but it is available in Canada.
You know what? Thank you so much, Joelene, for joining us here today on the show, kind of getting through those myths versus truths of cold and flu. Today's parent is where you'll find all this information and so much more. We'll be back in just